What I'm about to share may change the way you think about the blood pressure medications sitting in your medicine cabinet. If you're taking amlodipine, losartan, or lisinopril, there's a good chance that some symptoms you've been attributing to aging, stress, poor sleep, or simply having a rough week could actually be your body's response to the medication. These are effects that many people were never fully informed about when their prescription was written. What concerns me most is that serious problems with these medications rarely happen because they were prescribed incorrectly. More often, they occur because people don't fully understand how the medication affects their bodies. As a result, important warning signs can be overlooked until a more significant issue develops. I'm Dr. Favor Adamy, and this channel is dedicated to bringing you the latest research on healthy aging in a way that's clear, practical, and genuinely useful. If you haven't subscribed yet, consider doing so, because the information we're discussing today could help protect you or someone you care about. Be sure to stay until the end. After explaining how these three commonly prescribed medications work inside the body, I'll share 5 important questions that every person over 65 taking blood pressure medication should ask at their next medical appointment. These questions can have a meaningful impact on your care, but they'll make much more sense once you understand the information we're about to cover. Amlodipine, losartan, and lisinopril are among the most widely prescribed blood pressure medications in the world. Amlodipine belongs to a group of drugs known as calcium channel blockers. Losartan is part of a class called angiotensin receptor blockers, ARBs. Lisinopril belongs to a group known as ACE inhibitors. Although they lower blood pressure through different mechanisms, all 3 medications are generally considered safe and effective when used appropriately. However, there's an important fact that many older adults are never told. After age 65, the body often processes these medications differently than it did decades earlier. The liver and kidneys, which help metabolize and eliminate medications, naturally become less efficient with age. As a result, drugs may remain in the bloodstream longer and reach higher concentrations than they would in younger individuals taking the same dose. This means that side effects that might be mild or temporary in a 50-year-old can become more noticeable, persistent, and potentially more serious in someone who is 70 or older. The challenge is that medication-related side effects rarely announce themselves clearly. Instead, they often appear as fatigue, dizziness when standing, swelling in the legs or ankles, a persistent dry cough, or simply a general sense that something doesn't feel quite right. Because these symptoms can easily be mistaken for normal aging, they're often overlooked by patients, family members, and sometimes even healthcare providers during brief medical appointments. Let's look at each medication individually because the warning signs can differ significantly. Amlodipine works by relaxing the smooth muscles in blood vessel walls. This allows the blood vessels to widen, reducing the pressure needed to move blood throughout the body. While this mechanism is highly effective for lowering blood pressure, it can also cause fluid to accumulate in surrounding tissues, particularly in the lower legs and ankles. Ankle and leg swelling is one of the most common side effects of amlodipine, especially at higher doses. In fact, it is one of the most dose-dependent side effects associated with calcium channel blockers. Unfortunately, this swelling is often mistaken for poor circulation or simply another consequence of getting older. For older adults, this misunderstanding can create an additional problem. When swelling caused by amlodipine is mistaken for a new cardiovascular condition, some patients are prescribed a diuretic, or water pill, to reduce the swelling, even though the medication itself may be contributing to the issue. When a diuretic is added to amlodipine in an older adult, blood pressure can sometimes fall too low, especially when standing up. This can lead to dizziness, lightheadedness, and an increased risk of falls. Falls are one of the leading causes of serious injury and death among adults over 65, which is why this issue deserves careful attention. In addition to swelling, amlodipine may cause fatigue, flushing, a sensation of warmth or redness, and in some individuals, worsening urinary symptoms. If you're taking amlodipine and notice any of these effects, do not stop the medication on your own. Instead, keep a record of your symptoms and discuss them with your healthcare provider. In some cases, a dosage adjustment or a different medication may be more appropriate. Losartan. Losartan works by blocking part of the renin-angiotensin system, a hormone network that helps regulate blood pressure and fluid balance. It is one of the most commonly prescribed blood pressure medications for older adults and is generally considered safe and well tolerated. However, there are several risks that become more important with advancing age. One of the most significant is hyperkalemia, the medical term for elevated potassium levels in the blood. Losartan can cause the kidneys to retain potassium rather than eliminate it. In younger individuals with healthy kidney function, this is usually not a problem. But in older adults whose kidney function may naturally decline over time, potassium levels can rise more easily. The risk may be even greater in people who regularly consume large amounts of potassium-rich foods such as bananas, oranges, potatoes, and tomatoes. When potassium levels become too high, they can interfere with the heart's electrical activity and potentially cause abnormal heart rhythms. Common symptoms of elevated potassium include muscle weakness, unusual fatigue, irregular or skipped heartbeats. The challenge is that these symptoms are often attributed to other causes, allowing the problem to go unnoticed. In severe cases, dangerously high potassium levels can become a medical emergency with little warning. Another important concern with losartan is excessively low blood pressure, particularly when it is combined with other blood pressure medications or diuretics. This risk becomes especially relevant during periods of illness. For example, if an older adult taking losartan develops a stomach virus with vomiting or diarrhea, dehydration can cause blood pressure to drop even further. Because the medication continues to lower blood pressure, levels can fall into an unsafe range. For this reason, every person taking losartan should receive clear instructions from their healthcare provider about what to do during episodes of acute illness. If you've never had that conversation, it's worth bringing up at your next appointment. If you followed along this far, you're clearly interested in understanding your medications and protecting your health. Many people watch educational content like this and move on, but staying informed can make a meaningful difference in how safely and effectively medications are used. Over many years of clinical practice, I've observed a simple but powerful truth. Lasting improvements rarely come from extreme measures. Instead, they come from making the right small choices consistently over time. That's the philosophy behind the 30-day blood pressure reset for seniors, a practical step-by-step program designed to support healthy blood pressure through simple daily habits, gentle exercise, and easy-to-follow guidance that can be implemented at home. What I've learned from working with patients is that those who achieve the best outcomes are not necessarily the ones taking the highest medication doses. More often, they are the individuals who combine appropriate medical treatment with healthy lifestyle habits that reduce the burden on the medication itself. When lifestyle changes effectively support blood pressure control, medication requirements may sometimes be reduced under medical supervision. As doses decrease, medication-related side effects may also become less noticeable. Many patients who have followed this structured approach have reported meaningful improvements in their blood pressure management and overall well-being. You may be seeing comments and testimonials from people who have already completed the program. Many of them report feeling more in control of their daily habits, more confident in understanding their blood pressure readings, and more reassured that they are taking the right steps to support their health. For most participants, success did not come from making dramatic changes. Instead, it came from following a simple, practical plan that was easy to maintain consistently. Enrollment is currently limited, and only a small number of spots remain available. If you're interested, you can find more information through the link in the description or by scanning the QR code provided. As a member of this community, you may also be eligible for a special discounted rate. After joining, you'll have the opportunity to provide your contact information for follow-up support and additional resources. Support from viewers helps make it possible to continue producing straightforward health education for older adults, especially those who may not always receive the time, guidance, or clear explanations they need elsewhere. Lisinopril. Now let's turn our attention to Lisinopril, a medication associated with a side effect that is frequently overlooked. Lisinopril belongs to a class of medications known as ACE inhibitors. These drugs lower blood pressure by blocking an enzyme that causes blood vessels to constrict. By inhibiting this enzyme, blood vessels remain more relaxed, allowing blood pressure to decrease. In addition to treating high blood pressure, lisinopril is often prescribed to help protect kidney function in people with diabetes and to support heart function after a heart attack. One of the most common side effects of lisinopril is a persistent dry cough, which affects approximately 10 to 15% of patients. This cough develops because the enzyme blocked by lisinopril normally breaks down a naturally occurring substance called bradykinin. When bradykinin accumulates, it can irritate the airways and trigger a chronic cough. Several features make this side effect difficult to recognize. The cough is typically dry and produces no mucus. It often becomes more noticeable at night. It may not appear until weeks or even months after starting the medication. As a result, many patients, and sometimes healthcare providers, initially assume the cough is related to allergies, asthma, acid reflux, or another respiratory condition. In some cases, extensive testing and multiple treatments are pursued before the medication itself is considered as a possible cause. If you have been taking lisinopril for several months and develop a persistent cough that was not present before treatment began, ask your healthcare provider whether the medication could be responsible. For many patients, switching to an angiotensin receptor blocker, ARB, such as Losartan, eliminates the cough within a few weeks. Another important concern with lisinopril is a rare but potentially serious reaction called angioedema. Angioedema causes sudden swelling of the face, lips, tongue, or throat. In severe cases, the swelling can interfere with breathing and become life-threatening. Although it occurs in fewer than 1% of patients, it can develop unexpectedly, even after months or years of successful treatment. Any sudden swelling involving the face, mouth, tongue, or throat in someone taking lisinopril should be treated as a medical emergency and evaluated immediately. The importance of ongoing monitoring. Perhaps the most common mistake older adults make while taking blood pressure medications is not knowing what monitoring should occur after treatment begins. These medications require periodic evaluation to identify potential problems before they become serious. General monitoring recommendations often include regular checks of kidney function and potassium levels for people taking Losartan, similar laboratory monitoring for those taking lisinopril, periodic review of dosage and side effects for individuals taking Amlodipine, especially if leg or ankle swelling develops. In addition, anyone taking blood pressure medication should contact their healthcare provider if they start a new prescription or over-the-counter medication, make significant dietary changes, experience vomiting, diarrhea, or dehydration, begin taking nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen on a regular basis. Each of these situations can alter how blood pressure medications work in the body, potentially affecting both their safety and effectiveness. So, the key message is simple. Blood pressure treatment does not end when a prescription is written. Ongoing monitoring, awareness of side effects, and open communication with your healthcare team are essential parts of staying safe and achieving the best possible results. Before your next medical appointment, consider asking these 5 important questions. 1. Are my kidney function and potassium levels being monitored regularly while I take this medication? 2. Is my current dose still appropriate given my age, kidney function, and any recent changes in my health? 3. Could any of my other medications be affecting how this blood pressure medication works? 4. What should I do if I become acutely ill, such as with vomiting, severe diarrhea, or dehydration? 5. Are there lifestyle changes I could make that might allow my medication dose to be reduced in the future, under medical supervision? These questions can help create a more informed and personalized discussion with your healthcare provider, one that goes beyond a routine follow-up visit and focuses on optimizing your long-term health and safety. Key takeaways. Let's briefly summarize the most important points. Amlodipine commonly causes swelling of the ankles and lower legs. This swelling is often mistaken for a circulation problem or a sign of aging. When combined with diuretics, it may increase the risk of excessively low blood pressure, dizziness, and falls in older adults. Losartan can raise potassium levels without causing obvious symptoms. The risk is higher in older adults, particularly those with reduced kidney function or high potassium diets. Blood pressure may fall dangerously low during episodes of dehydration caused by illness. Lisinopril frequently causes a persistent dry cough that may be mistaken for a respiratory condition. Carries a small but important risk of angioedema, a sudden swelling of the face, lips, tongue, or throat that requires immediate medical attention. All three medications are widely used and highly effective when managed appropriately. Their safety depends not only on the prescription itself, but also on regular monitoring, open communication with healthcare providers, and healthy lifestyle habits that support blood pressure control. When lifestyle measures such as regular physical activity, healthy nutrition, weight management, stress reduction, and adequate sleep complement medical treatment. Medication doses may sometimes be reduced under professional supervision. A final thought. Many people wait for the perfect time to start taking their health seriously. The reality is that perfect timing rarely arrives. Small, consistent actions taken today often have a greater impact than ambitious plans postponed until tomorrow. That's the idea behind the 30-day blood pressure reset for seniors, a structured program designed to help older adults build practical daily habits that support healthy blood pressure without unnecessary complexity or stress. The program includes gentle, age-appropriate exercises, practical daily routines, easy-to-follow guidance, a step-by-step framework designed for long-term consistency. Many participants report feeling more confident about managing their health, more comfortable interpreting their blood pressure readings, and more reassured that they are following a plan they can maintain over time. For most people, success wasn't about making dramatic changes. It was about following a clear and manageable routine consistently. If you're interested in learning more, information is available through the resources linked with this program. Join the conversation. I'd love to hear from you. Which of these medications are you currently taking? Amlodipine, Losartan, or Lisinopril? Were you already aware of the side effects discussed today, or did any of them come as a surprise? Share your experience in the comments. Your insights may help others better understand their medications and know what questions to ask at their next appointment. I'm Dr. Favor Adamy, and I believe that understanding your medication is an essential part of staying healthy and safe. Thank you for watching, and I'll see you in the next video. Medical disclaimer. The information presented in this video is intended for general educational purposes only and is based on published medical literature and publicly available clinical resources. Amlodipine, Losartan, and Lisinopril are widely prescribed and effective medications for managing high blood pressure and certain cardiovascular conditions. The side effects discussed in this presentation are documented in medical research and are shared to encourage informed discussions between patients and healthcare professionals. This content is not a substitute for personalized medical advice, diagnosis, or treatment. Never stop, reduce, increase, or change any prescribed medication without first consulting your healthcare provider. Making medication changes without medical supervision can result in serious health complications, including cardiovascular emergencies. Always seek advice from your physician or qualified healthcare professional regarding questions about your individual medical condition or treatment plan.